Welcome to everyone. Today is Kopi with Vans time. That's right. It's your daily, rather weekly topic. And today I have a guest speaker who is Dr. Yudara. And we're going to talk something about Unzip the Facts, the Zen Z Guide to Penny's Health, and STI prevention. So we are doing a recording version tonight. And let's invite our guest speaker, Dr. Yudara. Hello, doctor.
Hi, Vance. Thank you so much for having me.
Thank you, doctor. Thank you for joining us very late today. And I'm sure looks like you're not at home right now.
No, I'm still at the office.
Okay. Thank you, doctor, for joining us tonight. Doctor, before we go on, you want to do a quick introduction so that we can jump into the questions and the topic today?
No problem. My name is Dr. Yudara Kularatna. I'm a consultant physician who's practicing in Singapore under Sing Health Group. But after COVID, I take a step back and then started my own startup after seeing how the world needs a little bit more adventurous physicians, especially on the diagnosis side. So eHealth is a digital diagnostic startup where we help men to diagnose sexual health issues early. But I'm happy to share more later during the questions.
Thank you for joining us, Doctor. It's a great pleasure to have you. Today's topic is going to be very exciting. A lot of time, it's not a stigma, but people are a bit shy to talk about this. Before we even jump into the topic, is there any particular reason why, Doctor, people don't want to talk about sexual health or even, the penis, the vagina? A very, very, people are very shy and, don't want to use the words. Is there any particular reason why, Doctor?
I'm not sure why is the reason, but it is a taboo. You said it may be not a taboo, but it is a taboo. Believe me, in Singapore, even when you pronounce just now the penis word, the word comes a little bit lower sound. This is how we've been brought up in the society.
Wow,
So,
wow. You caught me there.
of course, that's my job,
Wow.
right? So
So yeah, so
that's the low key stigma we are talking about. Actually, social media don't talk about it, and then
yeah,
at
yeah,
family, even there's a proper English word to tell in scientific means. People don't talk about it, and people use different words, and then this is how we've been brought up as a society. But this is not right. We have
that's
to
right.
be very straightforward. That's why I told penis as loud and clear so that
Okay,
this gets across.
right. So we are going to use an emphasis on that particular word louder than ever. All right. Thank you, Doctor. I mean, like I mentioned to all the audiences today, that we are live in Spotify, YouTube, and Facebook and LinkedIn as well. So it's a recorded version, but you can actually listen to them anytime at your conveniences. Doctor, so let's jump into the topic today. Let's unzip it, not zip it. But can you provide an overview of these common STIs that affect young adults, especially, or rather overall, and explain how they can impact the penny's health?
Yeah, actually, it's not limited to young adults. Anybody
Wow.
can get it, and surprisingly, we are seeing some parts of the world, elder population are getting STDs now. So, but
Yeah.
let me unzip it. As you said, what are the common things? So, I would broadly put it in few categories so that you can understand. The biggest category I usually put it, which is the commonest in Singapore, is what you call discharges. So when you look at it, you will see an abnormal discharge. Sometimes it looks like a white color, but it's not the usual one you would have.
Right.
And some color, sometimes, of course, it can be thick, yellowish, brownish, greenish, you name it, all the colors, but abnormal discharge from the penis. These things can be related to chlamydia, gonorrhea, and few other things. Definitely, you need to get treated. The other big group I put it is you get wounds on the penis, which is herpes, and syphilis. And these ones, whether it's painful or painless, you will have a small wound, so sometimes it can be actually big wounds. Surprisingly, these things can get cured by itself, but it will come back and hurt you again. So you need to again treat these things. The third
Right.
group I put it is the growths, which is
Right.
the commonest, very common in Singapore also, so-called HPV, human papilloma virus derived anogenital warts.
Right.
And again, people think this is non-sinister, not going to happen anything, but no, you are wrong. This can cause cancer and all the other problems in the future. The
Right.
last group is the ones which you cannot actually see. The HIV is the leading member in that group. So these are the common groups, so that actually if you can understand if there's abnormal discharge, abnormal growth, or there's a wounds, Or if you have not so safe practices, you need to get tested. That's the key
Right.
message.
Right. And also, doctor, is it because we are living in a tropical country, and you mentioned a couple of other viruses that that affect, and that area it's always tight. It is not free at all. Though I think the only time when we are free is either we are going to the loo or either having a shower. I mean, you can't be just going out nakedly. But is it because of that tropical country that we live in? There's a lot of humid, especially in that non-exposed area.
Thanks, Vance. Actually, it's not. You do get fungal infections on the penis. We mostly don't consider them as actual true STIs, sexual
Right.
transmitted infections. But this is very common. As you said, when boys are doing army, national service, they get it
Right.
because they have to wear the same clothes for
Right.
many, many hours. And then sometimes, of
Yes.
course, you get wet. You still cannot change it. Yes. Fungal infections are common, but that you should not be complicated or mix or misread it as a STI or other vice versa. So it's very
Right.
important if you are not so sure or if you have any symptoms which is abnormal, better to get checked with a doctor. Or you can use other technological solutions which we can again talk. That's where the e-health is working, using artificial intelligence to get at least a better idea of what are those things.
Right. Yeah, doctor, I mean, also, is there a particular, like, annual checkup, or is it like every 3 years once? Because, for particular, like HbA1c, to check your blood glucose level, you have to do every 3 months or once a year. But is there something like for STI, or, I know you are coming from e-health. Is there any recommendation, or even Ministry of Health? Is there something like, like adults should go and check it out, like every 5 years once? Is there something like a guideline there?
That's an interesting question, man. As far as I know, in Singapore, Ministry of Health
Right.
have no indication for
Guideline. Right.
how common we or how frequent we have sex.
Okay.
But as far
Okay.
as you have sex, you are exposed to STIs.
Right.
So if you're having once a year, maybe you can check once a year. Okay, I'm just kidding. As far as you're sexually active, you need to get
Okay.
tested as
Right.
early as possible, as frequent as possible. But
Right.
I cannot actually put a number per se. So
Okay.
it depends on how frequent you have sex, what kind of
Right.
activities you are involved in the sexual activities. Is it high
Right.
risk, low risk? Whether you use protection all the time? Is it with a single partner? All these
Okay.
things actually matters. If you consider
Right.
it overall as a low risk, maybe at least once a year you need to get checked. And that's
Right.
why in the healthcare appointments, usually they will put it as once a year, or like work permits, they put it as once or twice a year.
Right.
But if you're actively engaging with high risk sexual
Mm.
behaviors
Right.
without protection, of course, we would say every month or every 3 months would be the best.
Thank you, doctor. Thank you for this. I mean, this is just the first question, and there are so many sub questions to it, and I'm sure there are more to come in.
Yeah.
For viewers
I
who are
mean,
watching, sorry, doc.
yeah, I mean, I can add here, right? This is my life's mission now. What
Okay.
eHealth does is we are
Right.
creating digital tools to truly understand whether you want to do tests, when you want to do tests, and how frequent you
Okay.
will need to do testing. And some of these diseases, actually, we can diagnose or detect from the phone itself.
Yeah.
You might not, for example, HPV
Yeah.
viral warts, you can
That's
detect
right.
it very well. We have close to about 90% or more than 90% accuracy detecting. You don't need to do anything at all. And this is in the phone. There's no
It's
barrier. You
going to
can
be
put
very interesting, doctor, because we are going to talk about the AI technology as well. Because AI
yes, yes,
technology has went into the medical field, and also as
correct.
viewers, you all know that AI has also pretty much went into a lot of places or a lot of sectors and environments as well. So, doctor, I need to share with you this, right?
Sure, sure,
Just a
sure.
couple of weeks ago, I was at our airport. All right. So there isn't any cleaners. There's all robots are moving around. And then me being the most mischievous fella, I stand in front of it and he just gave me a warning. Please stay away. So I think AI is becoming a part of it. We are definitely going to ask you on that. But right now, let me just go into the second question as well. So, Doc, I mean, as we are talking about STIs and as well, but probably we will now move it to the Gen Z. What are some key practices and habits where these Gen Z individuals should adopt to maintain optimal penis health and prevent STIs?
Yeah, it's a solid question, Vance. So if you look at it, this area is being not innovated significantly for the last 20, 30 years.
Right.
And I think about 20 years ago, WHO came up with this principle, so-called ABCD approach of STI prevention. A
Right.
stands for abstinence and B stands for barriers. But if you
Right.
look at Gen Zs, sadly,
Right.
none of these things are actually working. And
Mm.
we were talking about it, right? Like, so if you ask a 16-year-old, 18-year-old young guy to not to have sex, but of course the whole society is all the social media, all the things he see, he's having this curious nature about what the sex is about. And then instead of we asking them not to have sex, we should guide them of how to have sex safer. So that's why the strategy of A is failing miserably, because
Right.
that's not what the youngsters hormones are against it. And we know very well we all done funny things when you are young, but if we
Yes.
get the idea of how to do these things safely, that's
Mhm.
how we should approach. In the
Right.
last later part of the discussion, I'll touch what we proposing for the new ABCs. But
Okay.
I would say, so the most important thing is you have to understand, is there other ways and means of understanding risk? Because this is not something people talk, right? If you
Right.
don't, how do you understand these things when you're 16, 18? Yes, we do have a sexual health education in Singapore and most of the
Right.
countries and world, but is there anything more we can do which is personalized? What you've
Right.
been taught in the school as sexual health is a very general thing, but what that means to me, what that means to my own penis, how do I understand these things? That's
Right.
where the technology can come in. There are many
Right.
other companies working on this area with us. There are AI tools. Who would thought AI will be involved with the penis right in the first place? Yeah, maybe in the
Right.
airport, but now it's also doing things. That's how it is. So it will be able to actually screen for problems. It will be able to
Right.
risk stratify them. It'll now the chatbots are super smart and they can actually tell you what to do, what not to do. And so my mission is actually to guide them, this new generation Gen Zs,
Okay.
how they consume the information, where they
Right.
consume the information, how they
Right.
use the technology to use their own advantage, and of course, communicate them with the other parties very clearly. And we are not saying not to have fun, but safely. We will tell you how to do it and bring all the technological solutions to you. That's what we do.
Beautiful. Well said there, Doctor. For viewers who are watching us from Instagram as well, we are right now not live. We actually a recording version right now. We will be posting it into our social media, which is your Spotify, YouTube, LinkedIn, and Facebook as well. Kopi Events is Wednesdays, 9 p.m. But today we are doing a late show and it's a recorded version. And today with me is Dr. Yudara, and we are talking everything about sexual health, but particularly to the human, or rather the male penis. Have I said that loud, doctor?
Yep, that's loud enough. Yes.
Okay, just now I was like penis. Now it's a penis, right? But, Doc, I mean, as we are speaking about this topic right now, I have not seen AIDS. So is AIDS also a part of these STIs that we are going to talk about today?
It is. It is. HIV/AIDS is one disease in different stages, and it
Right,
is a STI considered. And there are a lot of innovation happened in STI,
right,
sorry,
right,
HIV and AIDS. But
right.
sadly, the rest of the STI is kind of forgotten. Yeah. But what I think is we have to take it as a whole and then approach head on to tackle this problem. Definitely,
Right,
HIV is the difficult one because it doesn't have symptoms. It's always in the
right.
blood until like things are really bad.
Right. Thank you, Doctor. So we'll move into the next question. Also, Doc, could you discuss the importance of the regular STI testing? I mean, we just talked about it. I mean, if you are heavily active in sexual, then I think, if you're not protected, and then I think your frequent of testing should be more. But under the STI testing and what young adults need to know about the testing process, I mean, most of them are worried what happens if I have it. But of course, your activity level in the sexual part is high, but then you're worrying about these side effects, or rather the effects are going to come into you. So what is this testing process? Can we talk a little bit on the testing process, doctor?
Yep, I would love that. This is the part where I come in. So last time, again, you have to have blanket things because, like, we have a discussion, and I said, okay, get tested every 3 months. But does that belongs to each person in our society? No, because
Right,
each person's the risk appetite is completely different. One person might be having sex for every 2 months, 3 months. One person may be having twice a day, and one person might be having a one partner, one person may be having five partners. Does the risk same for everybody? Obviously no. So how am I supposed to come with the answer to tell, okay, this is the regime I should be telling you? But we thought two steps ahead. What we thought is, okay, if you can share this information with our technological solutions like eHealth, we can actually come up with personalized testing regimes, how frequent you need to do, what is the risk appetite or the risk exposure you've been exposed to STIs. Even for HIV, we can actually risk stratify some of these things. Of course, some of the technology is available, some of the technologies are building, but as someone in the Gen Z exploring the sex for the first time, what we would say is use the technology as a solution to understand yourself, understand your risk, and then, of course, find the right testing solutions and regimes for you. I would say generalize um, the rule at least about every 3 to 6 months, you need to get
Right.
tested if you are sexually active.
And doctor, where this testing can be done?
Okay, this is very important. We are very lucky in Singapore. We have a very good organized system, and we have a government system which is catering very well. Prices are super low, and of course, you can use Medisave. And we have a DSA clinic in
Okay.
Kelantan, and then we have a national NUHS system. They have a STI HIV clinic, and then of course. There's another one in the National Skin Center. They have
Right.
STI HIV clinic. So these are the government ones. And of course, I'm not going to mention the private sector names, but there are few groups which is very famous
Right.
focusing on HIV STIs. And of
Right.
course, I had to tell also, we are also starting our own clinic group with the partners that we will be providing full set of HIV and STI care and with privacy security. And of course, you can manage and follow up with our app also.
Thank you, doctor. You know, doctor, I mean, even for sometime when you do your tumor markers, or even when you want to do some testing, or the health testing, people actually quite worried. What if, right? But I mean, doctor, I mean, if it's a good thing, because if you don't go and check, you never know. And if you get checked, and if you know your symptom, you can do a lot of stuff to prevent it or to manage it. For under the STI, I mean, when we are, because we are particularly talking about man's health, which is the penis. If there's sign and symptoms, if a man notice there's a growth, or there is fungus, or there's painful sensations, burning sensation during urinations and kind of stuff, do you think he should get worried? And he think, I will go next week. I mean, that's what happens. I go following week. Let me Google up and then get more information before I see a doc. I'm shy to show the doctor my penis. Sometimes all these factors not talked about. So it's a good opportunity to talk today.
It is, it is.
Yeah.
Vance, let me share a small story which I
Sure.
experienced in
Okay.
my own in the hospital.
Okay.
So there was this lady, 50 something, not old,
Right.
came up with a breast lump. And then
Okay.
when I examined, it's a full blown stage 4 cancer. And we
Okay.
are living in Singapore and we are a developed, really solid healthcare system. I asked her why you did not come to hospital
Right.
until things are very bad. She
Yeah.
said, I was the simple answer. She said, I was shy. And then I told her, this looks like to me is a late stage cancer. Do you understand? Then she suddenly started crying.
Right.
Then I, of course, give time to, slowly come to a realization that what's going on. Then I ask, do you understand the gravity of it? She said, yes.
Right.
If I actually knew that it's possibly a cancer, I would have 100% come. But I
Yeah.
thought it'll just go away. And every
Right.
day I thought it'll go away, but it never go away. So
Right.
same thing comes to the men when it comes to the penis health. When people see something, say, oh, it'll nothing serious, it'll go off. But at some point, when they realize when they're trying to have babies, they might not get
Yeah.
babies. Then it's too late. Or like
Right.
some other things like HP related cancers, it can actually lead to cancer. Then if I tell you that you might even have to do an operation to remove your penis, people will be, like, I would rather
Shock.
die. So
Yeah.
these things can be prevented.
Yeah.
Obviously, whenever you see something, best is, of course, go see a doctor. But if it's not what we suppose is,
Right.
at least adopt technologies which can give personalized information. Once you get that information, if it tells you, oh, bloody hell, you have maybe herpes, then
Yeah.
people are like, okay, I need to go hospital, get it checked. So when you
Right.
hear that word, yes, but if you don't hear that things, they keep thinking, oh, it's nothing serious, and they will, like what you said, keep postponing and thinking that it'll go off. I think as a
Right.
society, where we need to come in is give this information to the youth, personalized, not blanket, and it has to be matched to the each person's and what they have, and
Right.
based on the risk, they will tell like, okay, this is what you have. go test it. Then people will be more inclined, and of course we must also give them the options of doing testing anonymously and remove all the other pain points.
Right. Thank you, doctor. Thank you for that. But I think that this is also leads to communication, and I think that is where our next question is going to come up. I think a lot of time there's not much of a communication is happening. So, how does communication play a crucial role in promoting sexual health and preventing the spread of STIs? What strategy? Because we are still focusing on the Gen Z, individuals used to have open and honest conversations about sexual health. What do you think about that, Doctor? I know it's a bit long question, but we
No
try to.
problem, no problem. I love it. Actually, this is something again I'm passionate. When I used to teach in university, I always say you
Right,
have to understand the receiving parties, the behavioral patterns. When
right.
we were, I think, Vance, you and me, we belongs to the older generation, right?
Fair, Doc.
At least when our time we used to talk to people person to person, but now the Gen Z's, they don't talk to person, they
Yeah,
prefer the text. But if I talk about communication as verbal communication, that's not going to actually give them an advantage.
right.
I have to talk about how the Gen Z's do it, and we
Yeah,
bring our technologies there where they are
right,
doing it. So they
right,
are text-based generation, they actually
right,
born with the handphones. I got my first handphone when I was 21. Obviously, that you can understand, very old. But now my son, he's 2 years, not even 2 years. He understands how to go into YouTube, skip the
right.
ad, find Coco Melon, and then play
Yeah,
it. Can you believe this? So
right,
that's where we need to bring the technology to the
right,
youth Gen Zs, how to
right,
communicate. Answer your question. So we think the text-based communication need to be very well thought out, have
right,
strategies to do it, and we have to
right.
have short emoji-based communication methods to get these things. If
There
you
you go.
put it in the Facebook and Instagram, I cannot put the penis word; they will block it.
Yeah.
And
Yes.
then, of course, now you put eggplant, everybody knows they talk
Ah.
about the penis. So
So the
these are
penis
the
has become an eggplant.
exactly these are the communication strategies we need to understand.
Right, right.
So we need to
As
use
the
the
as
right
the
language.
as the AI is evolving, we humans also have to evolve to be a match
Exactly,
or better than
exactly.
that, right, Doc?
Exactly. So, and the other thing is, if you look at how the people used to meet, last time we as youngsters, we had to go to
Right,
club or something to find a girl to talk. Now, nobody goes and talk people like that. They all do it digitally in the dating apps.
right,
Exactly. So
right.
we need to bring technologies there. When the youth is there, we need to bring the
Mhm,
technology. Is there a
mhm.
way that we can actually promote youth to be honest communicating about STI testings in a
Yeah,
dating app? Those are the things we should be talking. Is there a way, like some of the texting, like messaging apps, when you put, they might be blocking. So is
mhm,
there a way that whenever people are talking about it, to auto
right,
generate the answer, say, oh, here are some facts about sexual health. If someone asking about someone else about STI, these are the
right,
nearby STI centers. Actually, we have the technology right now based on the AI to do these things in chat tabs and stuff.
right,
But sadly, I think as a society, we need to accept the fact that the youth need to get this information, and the text-based way is the way to get the information.
right,
And then we have to, as academics, as companies, as the general public, we need to
right,
build these things. You cannot just block everything and say, "Oh, there's no such thing happening." Oh, I
right.
think my son have no penis problem. No, it's
Yeah,
not.
yeah.
Parents have
Doctor,
to also accept these things.
it's going to be a bit interesting as well, which I find it a lot of adults, right, either male or female. I think most of the time we can confidently say it's a male. I mean, of course, we are not biased here. Um, that they don't want to use protected sex, right? They want to do unprotected, and I think that actually can cost because especially if someone has multiple partners or having one night, that kind of stuff. Um, there's a higher chances of course, AIDS and also the STIs. But one should, it's a discipline, not an individual responsibility. But if one doesn't do that, I think it's creating more problems to the society, or eventually, right? Because if someone having AIDS, I think that's going to go through a huge, not only physically, mentally, and emotionally as well, right, Doc?
Yeah, it is. It is. So I think comes two factors. One is understanding your own risk. And then if you prefer to have unprotected sex, for example, there are medications now what you call PrEP, pre-exposure prophylaxis. If you take
Okay.
these medications, actually you can stop transmitting HIV, STDs,
Ah,
some of
okay.
things. Of course, PrEP is very well documented for HIV, and there
Yeah.
are PrEP antibiotics for some of the STIs also. So if
Mm,
you think that, oh, you don't want to wear condom, yes, you can use these medications. It will reduce the risk up to certain percent. And the second part is, as I said, the communication. You need to tell clearly that I'm someone who's not willing to wear a condom, and I've
yeah.
been doing the same thing, so that the partner understand the risk. Okay,
Mm,
if I to have sex with this partner, it's a slightly more risk, so that the
risk.
partner can also decide. So that's why it's important to protect the both sides. You can protect yourself, same time you have to actually help to protect the other side. It's the responsibility part.
Can we conclude this because they don't want to wear the condom is because of the pleasure, increased
I mean,
pleasure?
there are a lot of scientific things, there are a lot of things which is from the experience I can tell, but
Yeah.
it's again boils down to the personal things,
Right.
some people assume that it's the pleasure, but some people even don't agree that there's a difference,
Right.
and there are so-called double blinded without knowing. You ask whether there's a difference, or some people
Right.
don't. So it's I think it's important for us to convince the youth, for them to understand by themselves and then make the decision. And again, we are not here to penalize things,
Right.
and whatever they choose, we have to build technologies to help them to still protect themselves. That's what I'm saying.
Right. Thank you, doctor. Thank you for that. We're going to take the last question, doc, and also that is basically about could you share some of the practical tips and strategies for overcoming barriers to practicing safe sex and to promoting overall sexual well-being among the Zen Z, but I think it should be for everyone. I think,
100%,
I
100%.
mean couples or this is becoming very common nowadays. So I think it's something that we need to talk about.
Actually, in my lectures, compared to the old WHO proposed ABCD, I've been
Right,
proposing a new one, also
right,
based on ABCD. A stands for adoption, B
right,
stands for be responsible, C for communication, and D for destigmatize. Let me
right.
add a little bit about the adoption part. As I said, there are
Okay,
lots of technologies are being built to get the
right,
personalized information, and some are
right,
even going into a level that they can detect diseases like what we do at HeHealth,
right,
and they can give personalized information. So adoption of these technologies in right places, like the
right,
dating apps. And if
right,
you think that these things happening in there, you bring the technology there. And we talk
right,
about the communication in chat apps, you bring the technology there. And now our LLMs, large language model like OpenAI,
right,
ChatGPT, these things can be incorporated into Gen Z communication modes. Whenever
right,
you ask something, it actually jump in and help to give the right
absolutely.
answer.
Yeah,
Those are the ones what you call adopt the technology. B is the responsibility part. With COVID, we all know it's not about only yourself. You cannot just say, "Oh, I don't want to wear a mask," but government say, "No, you must wear a mask because it
yes,
spreads to the others." So these are
right,
the responsibility part. What we say is get tested regularly and know your status, and then of course use barrier methods as much as possible so that you be responsible, and of course
right,
communicate these things to the opposite party clearly. This is
right,
my status. I've been checking every 3 months. I use PrEP and I don't want to use a condom, or you want to use a condom. So
right.
C is for communication. Communicate this clearly even
Yes,
before you think about it. And now the text base is not that difficult to tell, like last time I want to tell something, I feel shy. But text base, okay lah, just send it over, so that people
yeah.
understand.
Yeah, but doctor, I'm going to stop you here for a while, all right? I'm just giving you a quick, very unprepared, or rather, probably you prepared, right? During a very intense moment between a couple, all right? There's no time for condom, right? But do you think the guy will have the time to explain to her, I've been doing regular checks. I'm very responsible. I mean, that's what I'm going to
That's
ask.
a solid question, Vince. So I'll give you example. In
Okay,
some of the, especially I do work a lot of things in US. They said,
okay,
look, I get matched in dating app.
yeah,
The second message is already I'm getting a penis picture. So
right,
these
right,
things can be communicated beforehand, before even you
right,
meet. That's what
okay,
I'm saying. And you don't have to obviously wait until you meet. No, that's not going to happen.
wow,
And we have built digital technologies that when you send something, I can already scan, you know,
yeah,
and talk about these things before even you do something else, before you meet, communicate
yeah.
these things clearly. That's what you do. Of
Nice.
course, we are definitely missing part pins as adults. Like last time, those are the times we think of communicating, but no,
Yeah.
we bring the communication much earlier
Mm.
stage nowadays.
Thank you, Doctor. Just okay, for viewers who are watching this, thank you so much. We will definitely be uploading Dr. Yudara's interview. Just stay tuned. For now, adios, amigos. I'm gonna see you. Bye bye to them. Bye bye. Okay. Just hang on down. Okay, Doctor, thank you. I mean, we have already went into almost about well,
30
five
minutes.
and 30 minutes, right? We were
Not
talking
bad,
about
not
it
bad.
only for about 20 minutes only, but I think the topic can just jump in and go on. But before we coming to the end part of the interesting doc, um, is there something that you would like to say for our audiences? Because I know this topic can literally go for hours and hours, but in a nutshell, as we talk about the common STIs that affect young people, and what are the impacts on the penis health, is there something that you want to tell our viewers and listeners for today?
I think the most important thing is what we put it as ABCD. So do not hesitate to talk about these things. So first thing, be loud about it, talk about it, and then understand yourself. It's not about
Right.
others, understand yourself. And then, of course, seek help whenever you need. So,
Right.
technology is built in for every step of things we talk about, and then
Right.
please use it. That's all we are asking.
Right. Thank you, Doctor. I mean, we have covered the first part. I'm sure there's going to be many more parts that we will have with Dr. Yudra. And I think after your trip that you come back to Singapore, I think we will engage more and we can dive into a live segment as well to gather more information from you and your expertise and to all our viewers as well. So thank you, Doctor. Thank you so much for your time today. I know it's almost, wow, 11:20 and you're still in your office. Thank you so much, and we're definitely
No
going to
problem.
catch you up for coffee.
Yep, definitely, Vance. Have a good day. Thanks for hosting me. It's been lovely, and not everyone's willing to talk about this topic. So it's very important, but I would love to do a live session and to take some ask me anything questions. I'm pretty sure a lot of youth have questions. Next time we can try that. Yes, looking forward. Bye.
Thank you, Doctor.